We are live now.
Good evening, everyone. It is my honor to welcome you all for this wonderful podcast, a great initiative by our Fogsi president, Sunita Tandulwadkar ma'am, who had also initiated various other projects like Sampurna, Arogya Yog Yatra, and vaccination drive, which are successfully running. So, today in this podcast, I, Dr. B. Kalpana, Fogsi Infertility Committee chairperson, will have a conversation with Dr. Suchitra Pandit, ma'am, past president of Fogsi and also holding various prestigious positions in international level. So almost 48,000 gynecologists are watching this podcast. Actually, Foxy president is now flying because of that she could not join. On her behalf, our dynamic vice president, Shyamal Seth from Calcutta, has joined us to bless this program. Shyamal Seth sir doesn't need any introduction, but formally, he is a medical legal expert from Calcutta, visiting specialist also, managing committee member and office bearer of Bengal Obs Gyne Society, past chairperson of MTP Committee Fogsi, and organized various prestigious conferences in Calcutta. Welcome, sir. Requesting you to bless the program.
Thank you, Dr. Kalpana. It's an honor for me to replace none other than the Foxy president, Dr. Sunita Tandulwadkar, to say a few words on this occasion. Now, this is a great initiative on our behalf. No doubt about that. You perfectly mentioned about that. And I think this is an opportunity for all the committee chairpersons to have this program once a month. This is unique. This is something unique. And sometimes we feel cuss. हमारे time में भी ऐसा होता. So anyway, now we have our guest today, special guest, Dr. Suchitra Pandit. She doesn't need any introduction as far as Foxy members are concerned. All are watching how dynamic she is, how active she is, how enthusiastic she is, and more importantly, she is very encouraging for the juniors. At least I can realize that. The years I am in Foxy in active form, I have seen her, I am watching her, and she is a huge inspiration for me. And without wasting any more time or saying any other words, you can go ahead with the program, whatever kind of confirmations you plan to have with Dr. Suchitra Pandit. Suchitra Di, welcome, welcome, welcome. We all are waiting to listen to you.
Thank you so much, Shamal. Thank you so much.
Thank you so much for your blessings, sir. So as Shyamal said, sir told, Suchitra madam, who is a dynamic person in Foxy, doesn't need any introduction, but let me introduce her with her credentials. She is not only past president of Foxy, now currently she is Foxy representative to Suffolk and co-chair of NCD committee Suffolk. Previously, she was associated with the FIGO Ethics Committee 2023 to 25 and also chairperson of AICC RCOG. She is president of Isopar Justosis and Foxy ICOG. And she has got a teaching experience of almost 4 decades. As Shamal sir said, you are an inspiration for many of the youngsters. So let us have a discussion about your journey, starting from the beginning. And I just want to know, how did you enter into the field of medicine, then into obstetrics and gynecology? That is not an easy job. After a decade of tiring learning, you have explored into department of pharmacy or medicine field of pharmacy, and you have completed DPharm also. How did you get that interest, and what made you to complete that too, in addition to this extensive degrees, ma'am?
First of all, thank you very much. First of all, thanks to Dr. Sunita Tandulwadkar for initiating this program. She is a great leader and has got fantastic things lined up for the entire. I've been a part of several of her programs, and I'm really enjoying every bit of it. Thanks to Shamal, current vice president, for all those wonderful words about me, and Kalpana, thanks for giving me this opportunity to speak about myself. Well, let me tell you, from childhood, I always wanted to do only medicine and nothing else. So even for the school programs, I would be singing one song. In Marathi, it's like Dr. Honara, means I want to be medicine, I want to be a doctor, and I used to carry the doctor kit everywhere. Over the years, after I finished my schooling, and I was like, anybody would ask me, what do you want to do? I want to do MBBS. And in our times, we did not have the 12th standard. Ours was the last batch of the inter-science. And that particular year, what had happened was, since I had done senior Cambridge, I took a direct jump to inter-science. I did not do first year at all. And that particular year, the results were very, very strict. They were based on the inter-science results. And I did well. So I said, I'll still walk into, this particular year. But 2-3 big things happened. The reservations suddenly from 11% went up to 35%. So a big number of seats were cut off. Then the additional marks which you get, I did not get, because they said, you have jumped, so you have not done first year, so we cannot give you the 10 marks. And I used to take part in elocution competitions at the university level. So on my, the certificate, the word university was not, national level was written, because I'd also represented the university at the national level. But the clerical staff, how their brains function. No. You have not, this word of university is not written. So 10 marks. So karte, I lost 30 marks, and I was still on the waiting list, thinking, okay, today I'll get it, tomorrow I'll get it. And that did come. And finally, I had dentistry and BPharm, and I took up BPharm. But all the time, my mind was focused on, I want to do MBBS. And in Mumbai, in those days, we did not have this culture of entrance exams, which was existing outside Mumbai. So I had not filled in the forms anywhere. So I said, doesn't matter, I'll take up pharmacy. And my father said, no, let's pay, a capitation. I said, no. If I get it, I have to do it on my own. So I finished my 3 years. Those days, BPharm was a tough course of 3 years and not 4 years, now just 4 years. So I finished my BPharm exam. The day I finished my exam, I went in and gave my exams at the All India exams at Sevagram Mahatma Gandhi Institute of Medical Sciences. I got selected, and I got it on my merit. And then my father said, of course you must go. There's no looking back. So I'd already finished BPharm exams. I got a first class there. But, everybody would say, but why are you coming here? I said, because this is what I want to do. But the advantage was, I had got a double promotion from upper KG to second standard. So I'd saved that 1 year. And then I jumped from school to inter-science. So I'd saved that 1 year. So despite having that, I was still 1 year ahead of the class, but it didn't matter. And then there was no looking back. So there was the only thing that any time I wanted to do in life was, become a doctor. So that's how, and I was happy I did it without any capitation.
And we all know that you're a passionate teacher, almost with 40 years of teaching experience, and you're an inspiration for many youngsters too, as Shamal sir also said that. When did you feel that, very happy as a proud teacher?
See, when I was working in the teaching line, it wasn't just teaching, it was clinical teaching, being with patients, and teaching clinical work to our own students. So when your own students do very well, first thing is you're learning, you're talking to them, you're helping your patients, and then your students are complimenting you, saying that they've understood and they remember certain things because you have taught them. So that gives a very good feeling. Like, we remember some of our wonderful teachers at Sevagram. We had a fantastic set of teachers. So the same way, when students would remember me, and I enjoyed postgraduate teaching because when you're with your unit, you are seeing. So I was working at a very, very busy teaching hospital at Sion where you had loads of patients. So when you're looking after the patients, you're also learning from that. And that time we didn't have internet to access, we had to quickly read up. So there were cases which you could manage by the virtue of learning, by the virtue of experience, by the virtue of teaching your students. So you're learning and at the same time teaching. So that was a very, very great experience. And then when your students imbibe the skills, they get better than you, they go ahead in life and they do very well, you feel, oh, wonderful, I've done my great job. And every teacher's day, yesterday was Guru Purnima, you get so many wonderful wishes from your students, from your nurses, from sometimes you've not even taught them, you've not even been with them, but you've been an examiner, and they'll say, oh, thank you so much for being there, on for being our guiding light. So that's a very, very great moment.
Yeah, and also in addition to your 4 decades of teaching experience, you have almost published 142 publication. That is a huge number. How did you just told your college was the busiest one and you had too many clinical cases. But in addition to managing clinical cases, how did you publish so many articles and how was that possible, ma'am?
I've been doing a lot of projects, and I was involved as a coordinator of the International Term Reach Trial. Plus, I had the SIDA project. We did the Kishori Adolescent Empowerment Project. So those were clinical trials, which were their clinical projects which are going on. And I had made it a point that whenever we're giving a thesis to the student, we will only give a clinical subject. We will not do any retrospective studies. So that's how we also started learning. And I don't know if you're aware, but I worked for 3 years in the UK, where you learn a lot about how you manage in a systematic manner. So all those things I tried to put it into practice. I started to audit my own work, and that's how those skills you automatically start transferring to your students. And that's how you say, okay, now let's start publishing our data. Still, the amount of work we've done, we've not been able to publish that much. But when I was chairperson of Young Talent Promotion Committee, which I took up, so those were the things which I had sort of encouraged my juniors. We'll start thinking of a subject, we'll start learning how to research literature, how to start looking at publications, how to start writing, how to write a good publication. And that's how I started doing my work. It wasn't more of theory, it was more of a practical oriented thing. And I think by the virtue of my extensive traveling, I think you will learn so many things from people when you're traveling around. And that's how you learn how to put things into practice. And then you start publishing your data. And at the same time, you get involved in national projects like misoprostol for induction of labor. We were approached by the government of India to be one of the the collaborators. So that's how you start working on that, and then you automatically start getting publications. So that's how you manage to combine. There are multiple things which you do. And remember, I was also associated with the Mumbai Society. I was also associated with Foxy all throughout my years. And all those things, teach you a lot. I'm not just sitting in a medical college. So there are lots of multitaskings which you're doing at the same time. And that's how you learn to go ahead, with whatever you're doing.
You have already told that you have been associated with various projects, nationally and internationally also. One of the best project to name was International Breach Trial Project. Can you please tell us in detail about that?
Yes, before that, I think I have to tell you how I got into this particular project, because I'm a very, very avid traveler. Thanks to my father, who has encouraged me and my siblings to, travel a lot. So I've done a lot of intensive traveling around the world. Around, not just because I wanted to go and buy stuff, but with a backpack and with a shoestring budget, travel all over the world. So I've done those kind of things. So when I worked in the UK, after 3 years, I came back to India. I was determined to come back because I said, whatever I do, I have to do it for my own country. My parents are here. I don't want to stay in UK. I have to come back. I have to go back to my own country
And since I'd taken study leave from Science, I came back to Science. The following year, I said, I've never attended an international conference. So let me start. The first FIGO conference I attended was in 1997 at Copenhagen. And there we had this lady, Mary Hanna. She was talking about recruiting centers for, the international term breach trial, because they wanted to find out whether vaginal delivery is safer or whether cesarean section is safer. Mind you, in India, as students, as postgraduates, we've done breech deliveries. You also would have done them. We were all used to using all our criteria and deciding. So I said, yes, this is a good project. And that from Copenhagen, I was going to go to Toronto. My brother lives in Toronto. I had asked him to set up a meeting, and which he promptly did. And when I, met Mary Hannah, she said, oh, wow, with this wonderful, data that you already have at Sion, such a huge hospital, why don't you fill in the ethical committee, get the ethical committee permissions? And I did that. And we got this, term breach trial. There were 3 centers in India. One of them was Vellore, one of them was Mumbai R, and one of them was Vadia. And at that time, we didn't have mobiles, no internet. Everything had to be done through the fax to even get the randomization. It wasn't easy, but we were good. We were very compliant. And in fact, our countries, our Asian countries, did very well for the recruiting. It was the European countries and UK and America in particular, where they were not taught, or maybe they were not used to the breech deliveries at that time. And they had a higher incidence of morbidities. So after 3 years of the trial, it had to be stopped interim, because they said they're finding that cesarean section is much more better than vaginal delivery. Of course, they said, in the context of your regional setting, you have to find out your own way forward. But eventually, that's how the trial stopped. And this was already published in the Lancet. Of course, now there is a turnaround and things are talking, people are looking different ways. But it was wonderful to know how to do randomization, how to go forth and, do that kind of a trial. And, that particular year, when I got this term breach trial project, that was a year I also got my SIDA fellowship. So I went to Sweden and Uppsala. I spent a month over there, and it was great learning on how do you write a project, how do you carry out a project. And when I came back to India, I had taken adolescence as my subject. So when I came back to Science, I spoke to our dean, Dr. Albeda Fernandez, to the head of the department, Dr. Daksha Pandit, and Dr. Durusha was the president of Fogsi. I said, this is something which I'm very keen on doing. And Durusha was also keen on adolescence, and she could get the funding. We could get all the other data, and we started working. And that's how the Kishori, the adolescent empowerment project of Fogsi, was born. So Kishore, it was Fogsi, Sion, UNICEF, ICDS, Kishori, Sakshmi Karan Prakalp, which is done at Sion Hospital. And it was large. It took me 16 times for rewriting that particular project till we got the right format. And then we had about 1,600 girls recruited from the urban slums of Dharavi. And we had our Anganwadi workers and the healthcare workers who we trained with the help of UNICEF. And these ladies in turn trained the adolescent girls. And then we started the Adolescent Center at Dharavi, where even apart from health education and reproductive health skills, we taught them, we employed people. We had a coordinator who we employed people who would come and teach them, like the sewing, cooking, beauty, the parlor, how do they train, the henna. So these girls they were all school dropouts. So they could actually earn a living from that. And Kalpana, you won't believe, 6 months after they finished the first certificate course, we had Waida Rahman, the famous actress, come in, and she gave them the certificates, and they were so happy. It encouraged more and more girls to come in. So every 6 months, we would call a celebrity, and they would give away the prizes, and we had girls participating. So this project went on for 8 years. Then we had chosen peer group leaders from this. And these girls also carried on the project. And then I left Sion Hospital in 2009. And the project, then the existing people did not want to continue that for whatever reasons. They had their reasons. And this project moved on to Dharavi and then continued for Dr. Durusha, was looking after it for 2 years. But, for 10 good years, we did this project. And it was like a role model for many other states to follow. We presented this internationally, very appreciated, and very, very happy about, the fact that we could do this for the community. Getting them a toilet was a challenge, but we finally managed to get one toilet, so the girls don't have to wait at night to go to the toilet. So, and many of my students also got involved in that. So, they learn that apart from your clinical things, you have to also work for social projects like these.
That was the success story of your chairpersonship, I think, during this 10 years. And obviously, you became the dynamic president of Fogsi, occupied the prestigious post, uh, which has also its own challenges during every tenure. What was your challenge during your presidential year, ma'am?
Kalpana, before telling you that, I'd like to say that, the journey to the presidency, people tend to say, I want to become president, so I'm joining Foxy. No, for us, it was not like that. I wanted to serve the community. The best way to do it was working through your own parent organization, that is Mumbai Society, joined in as a member. We had to do 9 years of just member activities, running programs, being a convener, you're trying to coordinate something, or just doing a postgraduate teaching program for monks, and 3 elections, and then we enter monks as a clinical secretary, and then after 9 years till you become monks president. And simultaneously, thanks to Dr. Usha Saria, who selected me as her joint secretary when she was a president in 2002. That's the time I really, my eyes opened up. Oh, so this is what is the presidency. So I learned a lot of the administrative technicalities. And she gave me a free hand. She gave me a lot of errands to run. She said, you must go to the, very distant places. So in the peak of summer, she made me go to Lucknow and Amethi for workshops, because she said, that's the way you will learn. And 44 degrees temperature with no AC, we've done workshops over there. So Dr. Sanjay Gupta, I had Dr. Noza Shere. So all these people, they used to give us Dr. Hema Debakar. I joined their respective committees, and I started knowing activities. And then after I finished my joint secretary's post, I became Young Talent Promotion Committee. Then 5 years of that, then Vice Presidency of Foxy. And then everybody says, of course, when you're Vice President, you should go ahead for the presidency. So the first challenge is fighting an election. But because you move the length and the breadth of the country, remember, Kalpana, no WhatsApp, no mobiles, no SMSs, but you do it on your own, in your own way. You talk to people on the phone, and I had a very nice relationship with with Dr. Atul Manchi, who both of him and me were fighting the elections. So we did it in a very nice, amicable manner. When I won the elections, first thing I told him was, I'm sorry, I have won and you have not won, but, we'll help you somewhere. And we helped him to get the chairperson's post of ICOG. So that way, we had a very amicable partnership. When just the year before I was president of Mumbai Society. Mumbai Society was the largest, society of Foxy. So there is a lot of work to be done there. Though you have a team, you have to raise funds, and that entire year you have to plan, you have to raise funds, and you have to book your hotels in advance for Mumbai. In 1 year later, there was a gap of, there was an overlap of 1 month where I got president of Foxy. That's where you've already planned your program about 3 to 4 months in advance. I had a very good joint secretary, Gorak Mandrupkar. We sat one day with all the, the farmers for the support that we get, the academic grants. We planned out our programs and we started setting the ball rolling. But remember, when you start off, you don't have finances in your hand and you've already planned out so many things. But fortunately, what happens is Foxy is a wonderful organization because you have many friends, you've built up friends over the years, and people come forward and say, can we do this program for you? You give us an idea. So that's how we started working. So the first challenge was gathering finances. The second was you all are friends. How do you allot the programs? But then I decided that my theme was empower women, empower India, pledge for excellence. So keeping that in mind, we planned our conferences. So we had the medical legal updates at Kolkata. We had the modern technology at Trichy. We had harmony with hormones at Mumbai. We had pelvic floor focus conference at Pune, and the empowerment, my own empowerment conferences, where we felicitated 75 women all over the country for their achievements. And they were not just doctors. Young girl who's climbed Mount Everest, a young girl who is unfortunately a Downs but has swum the English Channel. So, those kind of girls we picked up, and we made sure that, we were actually, giving, felicitating them. And I asked all the societies, wherever they could, I said, felicitate the achievers, not just young, all age groups, felicitate your women achievers. And along with that, we had wonderful programs planned for empowerment of women, like, the safety first, prevention of cervical cancer, PPH, HDP, and, well women's programs. So we did it through all our committees. And, we have one, that time we had 25 committees. So with them, we planned out these programs and prevention of cervical cancer. And then I had one, very, very wonderful thought in my mind, that we've got to work for the young people, for the youth, for the adolescents. So that's how we started off with the youth melas. I'll talk to you about that a little later. But along with these programs, your timetable is very tight. Time management, every day you have some activity. I see Sunita's program, it is even more bigger and more tighter. But way back in 2014 also, there were so many. And remember, we had the smartphone, but we didn't have the access, so much of access. It was only emails or faxes. We didn't have the SMSs and the WhatsApp, which are there now. So every program that you're planning, you have to look at the finances, we're looking at the time managements, and then you're saying, okay, now I'm going to do that. So Kalpana, if I tell you, from 2012, when I started campaigning, to 2015, when I handed over, the average sleeping time was 4 hours for me, because the maximum work you do at night, because you're also working. And I had 3 or 4 good people. All my friends were very helpful, but I had 3 to 4 very good advisors, where they would give me, ideas, and we would sit at night. Preeti Vyas, Pratik Tambe, Bhaskar Pal, Sujata Mishra, and my vice presidents, all of them would give me ideas, and I would sit and plan. And when you're planning, Makrand, you've heard of Makrand Desai, is the conference guy. He's, 2 3 things I learned from him. One is the computer slides, way back in 1998, when he started learning, and I was the first one to start using computer slides and computer posters. So he taught me one very important thing, was time management. There are 24 hours in the day. You keep aside your time for sleep, your time for relaxation, your time for food, time for your family, and then you still have these many hours. So every hour has got 60 minutes. Divide your time. So believe me, Kalpana, that time management was really wonderful. There were times when we were stressed out, where things were not ready. Your brochures are not ready. When you're going somewhere, you have to remind, have you got the brochures? Have you got this? Have you got that? And then you're planning your tickets, your itineraries. And it's not as if the Foxy office is going to do your ticketing all the time. You're doing it yourself. So a lot of planning has to be done. Then for women, the wardrobe has to be planned. So though you may have a secretary, you still have to look into these things yourself. I had to give time to my mother, but my mother was a great, great support. I lost my father when I was, vice president of Foxy. He would have loved to see me, sitting on the chair as a president, but he encouraged me for everything. He was a person who would say, your empowerment begins at home. So you do. At the age of 11, I could take decisions on my own, and he gave me a totally free hand for choosing whatever I wanted to do. And mom was a great, support. So she said, you go ahead and do your work. I will manage the home front. And continues traveling. 52 weekends you have. Only one weekend I was in Mumbai, and that was for Harmony, with Hormones, which was done by Amit Patke in Mumbai. He was the president of the Mumbai Society. That was the only weekend I was at home. And then, of course, the final weekend when we handed over to Dr. Prakash Trivedi at Chennai, that was the time. And I was happy that my mother could attend both my installation as well as when I handed over. So it was a great moment, and my family, great support, my brother, my sister, my cousins, my extended family, and my friends who are my family. Ramesh, Salvi, my brother Milind, his wife Madhuri. I mean, all of them, they have been great. And my cousin, Mohan's wife, all of them, they were there for my installation. So when you have that family support, when they're complimenting you, congratulating you, giving you ideas, I think then all the work that you've done feels, yes, I've done something. And, when you're traveling outside, I love languages, so I can speak quite a few. And like, Tamil, Telugu, I can speak a little of everything, but I can speak Kannada quite fluently. So when I'm traveling, I'm learning I'm learning a lot from the people. And when they feel, okay, this is something which we've understood, you feel great. And Kalpana, I'd like to tell you about one very, very important project is hypertensive disorders in pregnancy. So in my year with Dr. Sanjay Gupte, Girija, Gora, Kalpesh, we got this wonderful certificate course of hypertensive disorders in pregnancy. Hema was also guiding us. And it took us 3 long months to prepare the entire course, and 40 experts went through the entire thing. And then finally, that certificate course was born. And we did 108 of them. Every week there was someone or the other from our group, Justosis group was also born at that time, and they were traveling and doing this particular programs. And then I had my youth melas. Preeti Vyas was looking after my youth mela. So this was I was very, very passionate about this, because through this it was like a 2.5 hour program with fun videos prepared by my entire team, a young team from Mumbai Society. And we had inputs from a lot of seniors and quick videos and quick teaching, so people enjoyed doing it. We had a big TOT in Pune, and then through north, south, east, west, all the zones, the programs were carried on in junior colleges. And the additional thing, apart from reproductive health, we told these children about self-defense, about HPV vaccination, about staying fit and respecting seniors. So that was a very, very pet project of mine, which Preeti carried off very well. Yes, throughout you always are worried about where do the finances come from? How do we manage? And there were times when we literally didn't have money to carry on social programs. And I would tell the societies, if you can generate your own finances, do it. But this is a good program. Go ahead and do it. And trust me, I wanted to cut out on the fanfare. I didn't have those that much of finance, but whatever we could do, it was extremely satisfying. And the best compliment I got from the Ministry of Health and Family Welfare, they said, "Madam, we have seen your passion for working, and we are sure that all your projects are going to work well." We had the Deputy Commissioner of Health come and flag off our HDP program, and we had the then secretary come and come for and he would invite me for every single flag off of the government, like the Pradhan Mantri Surakshit Matritva Abhiyan. Was flagged off in my year and then completed in Alkar Kriplani's year. So that's the beauty of Foxy. You start off a program and there is a continuation. So that is, you want to cater to everything, to the mother, the child, the newer, the hysteroscopies, the endoscopies, the ART. So you have programs built in for all that. We have our committees to take care of that. So I think all in all, it leaves a very, very satisfying feeling. And, people say, are you very happy that you've done all this? Of course, but you want to do more. You can't stop at that. You have to keep performing, keep doing. Yeah, there are sacrifices. The health sacrifice is the biggest one, because you stop looking after your health. So I always tell people, be passionate about what you're doing, but don't forget your health, because health is your wealth. If you're healthy and your mind is healthy, you can do the maximum that you can. And Dr. Usha Krishna, she's now 93, she had told me, never use the word I'm tired. So she says, even if you're tired, just say, oh, I just want to rest a little. Never say I'm tired, because it's a negative feedback on the mind.
That was a wonderful journey, ma'am. You are known for gestosis, very popular for gestosis. Obviously, now NCD incidence is increasing. What
Yes.
is its impact on pregnancy in the current years, and what is your
Yeah.
experience with gestosis?
Yeah, see, with Justosis, one thing, our group, the group with Gorak, Girija, Sanjay Gupta, Alpesh, we've got this Justosis course. So we tell people, use this at the first visit, because this will give you a predictability. If it is 3 or more, just start calcium 1.5 grams and low dose aspirin, because you can do whatever your Dopplers and everything, but at least you've given the prevention right at the first shot. And of course, we are encouraging preconception counseling, where you can actually look at the NCDs, if they're chronic hypertensives, or if they've got diabetes, or if they've got obesity. You can start counseling them about that. So we found that using the gestosis score, it has now been validated, and it is already published in 2 journals, 3 journals in fact. we are finding it very, very useful, and we find it's a dynamic score. That's what I think India has given to the world. Every time, every visit, it can be used. It's a dynamic score. We tell people to use it because even in the later stages, if you use a gestosis score and if it's high, you know that this patient needs a vigilant monitoring and needs to go further to a tertiary center, because you know now with older age mothers, diabetes, obesity, ART, you know the things are going to be, and this is going to be the norm of the day. So therefore we have found that very, very useful. We've got lots of projects going on in gestosis, but we are trying to do our gestosis workshop. Currently Alpesh is the president, so you know I just was in Indore 3 days ago, and we did a wonderful workshop over there. So we want this to, you know, go on so that more and more people are benefited with this.
Yeah, you've started with your activities in Youth Mela, but you didn't finish. Please tell us about your Youth
Yeah,
Mela
see the
program.
youth melas,
The name is so unique.
no, youth melas, we've sensitized more than 50,000 students that particular year. And we did it with the Mumbai Society the previous year. We did it with the. This is a social program, I think, which has to be taken on by everybody. It has to go on. There are always going to be newer and newer ideas coming in. And now that we have access to technology, we've got such wonderful presentations. I think the youth melas must go on. And in fact, in Rishma's year 2016, in Nandita's year 2019, we did do the youth melas on a grand scale. We found them very successful. I would urge any and everybody, we have the modules ready. If you want to do this, it's easy learning, doesn't take much time. Please, the young people, and don't start very late, start early, start teaching them about the values of reproductive health. And you know, say no to drugs, say no to smoking, all this is there. But there are wonderful, simple tips which you can give the young people. You know, the incidence of suicide is now going very, very high. So now we have added on a quotient of mental health. So wherever we feel that mental health is having a problem, mental health is also an NCD. So these young people should be picked up and given counseling. So that's something which we have found is, is one of the byproducts of the youth melas. So I would say, Kalpana, whoever can do it, whichever committee, I'll give you the module. Just do it on your own level. It's going to be a useful thing for you.
Uh, we all know that you have been associated with various international federations like FIGO, SAFOG, RCOG, and whatnot. So, in what way association with the international federation would help our own people?
See, first of all, I believe that there's always a give and a take. When I was with the RCOG is extremely well organized. You know, the execution and implementation is what we have to learn from them. India is a large country, and at the helm of affairs is the president. You know, I'm talking about the Fogsi. We have to learn to get it right and make sure that the implementation goes down to the ground level. So, which is now being done very well, because now we've got additional committees, we've got vice president supervising, and there's a lot of work which is being done. So I think that was something which I learned and tried to make sure that, you know, we have that implementation. The other thing is they make very good guidelines, right? So we can't keep on talking about RCOG, ACOG, and SOGC all the time. So in my year, we had 8 GCPRs made that year, and they were systematically made. So I'm happy that that concept started off with Hema, with Dr. Sanjay Gupte. I carried it on. We did HDP, we did vaccination in women, we did anemia in pregnancy, we did cesarean section guidelines. So we are not all the time talking about the West, but we are looking at the West, and from there we are learning what we should do. FIGO again is a great body where they make a lot of, they have a big vision. They are looking at the world, at the global scenario, and we can learn what, something about environmental, pollution. That idea has come from FIGO, and we should be able to implement it because we realize there's so much of environmental problems going on in India. We are fortunate that we are able to execute it at some levels, but it has to go on more and more. So, the international organizations teach you that. But I'll tell you something, Kalpana, there is a lot that they can also learn from us. We have clinical acumen, we now we also have skill sets, where you've got the dummy labs where we're teaching our students how to work on the dummies first. But our clinical experience, your generation, my generation, we've learned it all on our, on our patients. Not that we mean that the patients should be guinea pigs, but we had our teachers to teach us. Now what has happened, the situation is different. Now we are on to skill sets, teaching how to do these things, practicing it on the dummies before you actually go on. You have the skills, you have the drills, which is again a concept which has come from the West, from the US, and it has come on to India. But that is the balance where you can make. And one thing which I must tell you, I learned from UK and from my CEDA project was communication skills. And in CEDA they had this wonderful sessions on various project planning. So one was communication skills. So each one of us was told to recite a particular chapter. You could read, you could say it off. So I said, okay, that time I was very much into prevent, menopause and osteoporosis prevention. So I talked about it. And then, you're supposed to comment on how you do. So I gave myself bad marks everywhere. And then she asked the other people, and I don't know those marks. And then finally she told me, something, you speak so well. I didn't know I could. You can express, you understand what your subject is, you're gesticulating rightly. That's the first time I realized, okay, I can speak well and I can communicate well, which means communication is so important. And Kalpana, the first workshop which I started off in Young Talent Promotion Committee was effective communication skills for improving doctor-patient interaction. And I thought I will not be able to. I did 38 workshops in 1 year. And after I finished, Parag Biniwale, and after me, after Parag was Bhaskar. Each of us evolved and did that, and that was one of the most popular, programs. And again, documentation, auditing data is what I learned from the West. And I tried to audit my own cesarean section rates, hysterectomy rates, cleanliness, infection rates. So I started learning, and people would come and ask me, please teach us how this audit cycle. One of my favorite topics for keynotes was auditing in OBGYN. But now, of course, everybody knows about it. But that time we talked about quality care and, things. So, but the West also have to, there are lots of things they can learn from us also.
And you were associated with the ethics committee of
FIGO,
FIGO.
FIGO.
And how important is ethics in our OBGYN practice or in
I think, I am currently an associate member, and I've already got those 2 papers which have come out. See, whatever we do, there always is an ethical aspect for it. There's a clinical aspect. We want to do a lot of things. But when I was in the ethics committee for the staff and research society at Kokiraben Ambani, where I was head of the department, and previously at Sion Hospital, if there's a clinical project, you are looking at all the clinical, you're looking at the funding, but look at the ethics. Are the patients being made guinea pigs? Are you doing something just to prove a point? Or are you doing something which is causing a benefit but harming the patient? So you're looking at the risk benefit ratio. Is it ethical to do this particular thing? And there are rules. So being in the ethics committee, I went in through a lot of those rules. So I was familiar with what ethics is. And this FIGO ethics committee is doing exactly that. Whenever people are making guidelines, they're looking into the ethical aspects. Recently, we have done the gamete donation. There are cross-country different rules, surrogacy, different rules. We're talking only of India, but FIGO is looking at the global body. So these are all analyzed, and we are now going to present all these in the form of the workshop. So this is something which the international organizations, and I think even in Fogsi, sooner or later we will be we will be looking at these particular things, because it's important. An institution has to have an ethics committee, because we cannot let our patients be guinea pigs, or anybody for that matter. Subject matter should not be guinea pigs.
And you have received various prestigious awards. One is FIGO Women's Award. How did you feel after getting that prestigious international award?
I think that is a great top of the world feeling, because when you're nominated from your country, remember Figo has got 120 countries associated with it, and there are 10 people who will get that award. So when you know that you've been nominated, you feel good, but after being nominated, that you'll be selected there, you're not always sure. So when you get that letter, and when I got that letter, I was very scared to even open it, because I said, if it says we are very sorry, I'll feel bad. So my mother said, no, just open it at least. When I opened it and I saw, well, you've been, we're delighted to inform you. Oh, I just jumped, and it's a great feeling. And when you actually get that award, I wish that award at that time it was, it's in the assembly hall. Earlier it used to be at the inauguration. I wish it was at the inauguration, because a lot more of your own country people, can be there, and you're happy, when you receive it amongst your own country people. But at least I had, Dr. Charmila and Dr. Jayam attend it, and they could take a video. So at least I had kept that video with me as a memory. It's a great feeling. And then even the Lifetime Achievement Award, I think every president who works for Foxy, or for that matter, even a chairperson, but chairperson is still at the junior level. When you're working as a president, you're at the helm of affairs. So you've put your heart and soul into it. And remember, you're doing it because you love doing it. You're not doing it for the accolades. There is no money there. You're, in fact, spending your own time, energy, money. You're enjoying. And when your own organization appreciates your efforts, that's, feels wonderful. It's like, when your parents say, oh, you've done well, you feel so good about it. It's the same way. It's like your parent organization saying, oh, great. It happened a little late in the night, but doesn't matter. I got that award, felt very good, and I could share this information. A lot of my family members were there, and they could actually see it on the WhatsApp. So it felt wonderful, wonderful. And I know, Kalpana, the next question you're going to ask me is, what next?
Yeah.
What next?
What
Well,
is the dream
what
that
is
is
the dream?
not
Yes, now I'll tell you.
fulfilled?
I'll tell you one thing which I've learned is, you have to keep dreaming, because then those dreams make you young. I'm waiting for a world when every Indian girl, and I'm talking about girls because we are a federation of OBGYN looking after girls. So, Shiksha, every education, every girl must have good education, good health, that is the swasthya. She should be independent, that is swavalamban. There should be samajik nyaya, meaning there should be justice, there should be samavedana, and there should also be a samata, which is equality. And for this, I want to desperately meet the Prime Minister Modi just for 10 minutes. And I have a 4-point program. First is, India has to be safe. We can teach our girls self-defense. We can teach them do's and don'ts. We can teach our young boys to behave themselves. But what about those perpetrators? Nirbhaya, the it took 7 years for her perpetrators to be hanged. So Modi ji, if we can have these people, if that fast track code can be fastened and hastened, so that the people, the all the perpetrators can be taken to stock, and there should be some kind of corporate punishment. It should be very fast, so that the people can learn suit, and then our young girls and our women and our older women, we can stand up and say, okay, we are great. The second is, you know uh, the Prime Minister has always talked about swachhata nyay, means swachhata nyas, meaning keep the country clean. But first thing for keeping the country clean is stop of import and export of tobacco and drugs in all forms. Because the moment you stop that, people will stop smoking, chewing tobacco, spitting on the streets, making it dirty. The lungs get dirty, the larynx gets dirty, the cancers of the mouth are on the rise. And in women who are, the BD rollers, they're having a problem. If they're pregnant, the babies are smaller. So if you want to get rid of this menace, you want to keep everything clean and green, stop this. Please stop import and export. One day will come when you will get no tobacco, no gutka around at all. And third and very important thing is NCDs. We are shouting because diabetes, anemia, we've been talking about it for years, but anemia is better. But diabetes, hypertension, Mental health problems, obesity, what about them? When are we going to get rid of them? So we have to have a national program. The cervical cancer, the national programs totally where they are tying it up with the maternal programs, with the antenatal programs. With this NCD programs, we'll be able to reduce the diabetes in pregnancy, the hypertension in pregnancy, the preterm births, the neonatal mortality, morbidity, the maternal deaths. We will be able to take care of them. If the mental health is good, you see so many women today have problems. They are stressed out, not just women, young children also. We have to take care of that. And for that, we have to put in the good diet, and that we have to have a good strategy. And very, very important in the NCDs is also cervical cancer. So HPV vaccination, please vaccinate all the girls and boys. And Kalpana, my last point, which I would like to tell Modi ji is, India today is a young country, but 20 years down the line, we'll be the oldest country. So please have some policies for older people. Even today, older people are not being taken care of in their homes. The old man is having a pension, the old woman is working in the house, yet it is the son or the daughter-in-law who grab that money, who give them very meager and very malnourished diet, who beat them, who ill-treat them. Something has to be done, some form of a law to take care of our older people. We must do this. 10 minutes and that's it. Modi ji's talk is over. Modi ji and his team can listen to this. Let them implement. Our Foxy is ready to work. We have got such wonderful presidents. Sunita is doing a great job. Bhaskar is coming on in line. They all will be hand in glove with you to do all the good programs. So please, itna to, that is my dream unfulfilled. The day all these four things are there, I can say, okay, I'm a happy woman. My Indian, ladies are all powered. And let me tell you, Kalpana, I'm a very, very proud Indian. There are lots of things which go wrong in the country, but I've always wanted to stay back. Very patriotic. I hold India in a very high esteem. But if something wrong happens, it pains our heart. So this is something which we all can work towards. And the younger people, I keep telling them, don't keep looking at your your end results. It's the destination is important, but it's the walk to the destination which is very, very which should be made enjoyable. So you work hard, you try, don't look at shortcuts, don't look at money as an endpoint. Look at the quality of life, look at what you can give to others. Share what you have, share your knowledge, share your wealth with others. And if we do that, we'll be a much more better country. And remember, our seniors have laid down the seeds and we are bearing the fruits. So similarly, the current generation should also sow something nice so that their future generations benefit. I think that is something which I'm sure you are an infertility person. You will agree with me that sowing those seeds, are very, very important. Nobody is born with wisdom. Nobody is born with clinical skills. It is our hard work, our clinical experience, and always have a good set of friends. I would like to thank all my wonderful friends, my wonderful family for whatever I have achieved today. And everybody has health issues, but you must learn to accept that and go on with life. So a negative point, yes, you feel bad, but you try to overcome that and then find out what is positive. So there was a beautiful movie, Gone with the Wind, where the heroine says tomorrow is another day. So today may be bad, but tomorrow is another day. So everybody should feel that, okay, time will change and tomorrow will be a better day.
Yes, ma'am. Your journey is really an inspiration for youngsters, and finally, for normal gynecologist, what will be your advice?
I think for anybody who aspires, we
Young
are a lovely
generation
branch because I
gynecologist.
think gynecology and obstetrics is a fabulous branch. Initially, I wanted to do pediatrics because I love little children. But then when I realized little children, sick children, no. I had bought a Nelson, I bought a pediatric stethoscope, but I'm very happy now that I chose OBGYN because obstetrics is a spring of life. all our subdivisions are giving life to the woman and her their newborn child. So we do wonderful work. So those who are wanting to OBGYN, please take the branch, but don't take it because it's an easy way to earn money. Yes, of course money comes in, money is a byproduct. So work hard. Many girls today don't want to do obstetrics. Oh, I don't want to stay awake at night. But no, it's not the staying awake at night. It is, you work as a group. Doesn't matter if you you get less money, but you work as a team. That's always so much more better. I've most of the time worked in institutions. I'm now in a private setup. But in an institution, you're working so beautifully in a team. You gain less, but what is money ultimately? Who goes up with the money? You need comforts of life, but you don't need luxuries all the time. So the younger generation, I would say, don't just look at luxuries. Look at look at the quality. Look at that. If you save a woman's life, if you give her a happy birth, she'll remember you. We once you have a difficult labor, the patients come back with such beautiful letters. Forget the gifts, but that the sentiments when they come up to when 40 years down the line, 30 years down, and they say, oh ma'am, see, this is your child. See, now this child is become a doctor. See, this child has become an engineer. So you feel so good. You've given something, you've given a new life to the world. So, think of that wonderful thing which obstetrics and gynecology, and it's a happy branch. I know we don't like cancers, so prevention of cancer we should work towards. And, we have gynec oncology today also, which is looking after our cancer patients. There's so much, look at the endoscopy, how it is minimal access surgery has changed the picture of so many things. Non-descent vaginally, we did so much of NDVH when we were at Sion Hospital. And, any part you take up, there is a pleasure in working in the branch. So love your subject first and then work towards it. Don't take up OBGYN if you feel you're forced to take it up or because your mom is having a practice. Take it up because you want to take it up. Because if you love something, it will never be difficult for you. If you love something, you will put your heart and soul into it, and your hard work will automatically come. And nothing comes easy. You remember, for simple references, we had to go to the library and search out. Now, at the drop of a hat, you get everything on the Google. So look at that journey of 40 years, how we did our thesis and how now it is so much more easier to do things. So people don't want everything easy, but I think, little bit of hard work on your own, self-realization. And Kalpana, I would suggest to everybody traveling. Traveling opens up your eyes, and don't travel in 5 stars all the time. Travel to open up your eyes. Do some trekking, do some backpacking. I used to do trekking when I was younger. I did Kailas Manasarovar, and they open up your eyes. You see the basic things that you need in life, and when you're that oneness with nature, uh, it evokes that spiritual sense in you, and that's where you learn. Okay, you are just one of the creations of God, and so those kind of feelings will give a lot to the younger people. Any branch they take up, but particularly our branch.
That was a wonderful message for the youngsters, and your journey beginning from deform to this highest position is really an inspiration for every one of us. Thank you so much, ma'am, for sharing your experience and guiding the youngsters. That is much more important. Thank you so much for spending your time with us. I should also thank Sunita Tandulwadkar, ma'am, Fogsi president, who had given wings to the chairpersons, given this opportunity, having wonderful podcast with great speakers. Thank you so much.
Thank you so much, Kalpana, for the opportunity. And once more, thanks to Sunita. I'm missing her because she would have, been very happy to give her own remarks. And
Probably fly.
of course, Shamal Sheth was there, so that was good. But enjoyed doing it. And, nobody's life's journey is easy. But it's great to speak out your heart, with you. Thank you very much for the opportunity. Thank you so much. Thanks to all my listeners. And I would say, be with Foxy, work for Foxy, work for Justosis, but whatever you do, work for women. Women's health is most important. Women's health is good, the entire family is going to do well.